Cystourethroscopy with insertion of radioactive substance, with or without biopsy or fulguration. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder, and inserts a radioactive substance. To release a radioactive substance, the physician passes an instrument through the endoscope. The physician may insert instruments through the endoscope to remove lesions or extract biopsy tissue from the bladder. The physician removes the instruments and cystourethroscope. Cystourethroscopy, with dilation of bladder for interstitial cystitis, general or conduction, spinal, anesthesia. Local anesthesia. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder and dilates the bladder with a balloon to relieve chronic inflammation of the bladder, interstitial cystitis. The physician removes the instrument and cystourethroscope. Would it be appropriate to report code 52260 for cystoscopy with hydrodilation of the bladder procedure as illustrated in the following operative procedure report? Or would it be more appropriate to report the unlisted code 53899? It would not be appropriate to report code 52260, as code 52260 is specifically intended to describe hydrodilation for interstitial cystitis condition. Cystourethroscopy, with internal urethrotomy, female. Male. Cystourethroscopy, with direct vision internal urethrotomy. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder. With a cutting instrument introduced through the cystourethroscope, the physician incises the inside of the urethral constriction. The physician removes the instrument and cystourethroscope. For incision of a female urethra, report 52270, for a male urethra, report 52275. If the physician incises the scar tissue or stricture within the urethra to open the lumen diameter while maintaining direct vision of the urethral lumen in either sex, report 52276. Cystourethroscopy, with resection of external sphincter, sphincterotomy. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder, and makes an incision, sphincterotomy, in the musculature of the urethral closure, urethral sphincter. The physician passes a cutting instrument through the cystourethroscope for resection of the external sphincter. After the sphincterectomy, the physician removes the instrument and cystourethroscope. Cystourethroscopy, with calibration and/or dilation of urethral stricture or stenosis, with or without meatomy, with or without injection procedure for cystography, male or female. The physician expands the diameter of the urethra. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder and dilates a stricture. The physician inserts a balloon catheter to dilate a urethral stricture or stenosis. The physician may pass a cutting instrument through the cystourethroscope to make an incision, meatomy, in the opening of the urethra or inject radiocontrast for radiologic study of the bladder. After dilation, the physician removes the instrument and cystourethroscope. Cystourethroscopy, with insertion of permanent urethral stent. The physician expands the diameter of the urethra. With the patient under anesthesia, the physician examines the urinary collection system with a cystourethroscope passed through the urethra and dilates a stricture. Using an instrument passed through the cystourethroscope, the physician inserts a stent to dilate the urethral stricture or stenosis. After placing the stent, the physician removes the instruments and cystourethroscope. Cystourethroscopy, with steroid injection into stricture. The physician treats a stricture with steroids. The physician examines the urinary collecting system with a cystourethroscope passed through the urethra and bladder, injecting material into a stricture. The physician passes an instrument through the cystourethroscope to inject the steroid into the urethral stricture. The physician removes the instrument and cystourethroscope. Cystourethroscopy for treatment of the female urethral syndrome with any or all of the following: urethral meatomy, urethral dilation, internal urethrotomy, lysis of urethrovaginal septal fibrosis, lateral incisions of the bladder neck, and fulguration of polyp, of urethra, bladder neck, and / or trigone. The physician passes a cystourethroscope through the urethra and bladder to treat female urethral syndrome. The physician may pass instruments through the cystourethroscope to incise the opening of the urethra, urethral meatomy, dilate the urethra, incise the inside the urethra, treat septal fibrosis of the urethra and vagina, incise the bladder neck, or destroy polyps of the urethra in the bladder neck or trigone with electric current, fulguration. The physician removes the instruments and cystourethroscope.